Hello and welcome to our patient information video on stomach acidity. There are millions of people worldwide who silently suffer from this distressing medical condition. Despite its prevalence, people are unaware of the causes, risks, and available treatment options for this problem. Today, we will look at two related medical conditions known as peptic ulcer disease and gastroesophageal reflux disease, which I will refer to as GERD. Now let's get into the details. A patient with peptic ulcer disease may experience the following symptoms: sharp stomachache or heartburn, feeling bloated or stuffed, excessive belching, a dislike of fatty food, or even nausea and occasional vomiting. If you have the following symptoms, see a doctor immediately. If you are vomiting blood, which may appear red or black, or having blood in stools or black colored stools, even if you have chest pain or difficulty breathing right after a meal, or if you have weight loss that is unaccounted for and unexpected, or if you have a poor appetite, it's time for you to see a doctor. A patient with gastroesophageal reflux disease may experience burning chest pain, which is typically worse after meals. This can usually happen at night while lying down. If having GERD, you can also suffer from throat irritation and a persistent cough, sometimes lasting weeks. So how does peptic ulcer disease occur? A bacterial infection called Helicobacter pylori, H. pylori, is a significant cause of this condition in our part of the world. Other causes include prolonged use of painkiller medicines such as diclofenac, as well as oral steroids. All these are causes of peptic ulcers. Though there is no direct link between stress and peptic ulcer disease, stress sometimes can worsen your abdominal symptoms. How does GERD occur? There exists a valve at the end of the esophagus that protects the stomach contents from returning back to the esophagus. When stomach acid rushes back into the esophagus, by esophagus I mean the food pipe that's connecting your mouth and the stomach, GERD, esophageal reflux disease, occurs. Your esophageal lining may become irritated by this backwash because of its inability to handle the acid. Your doctor might conduct a few investigations for these medical conditions, especially if they are severe and do not resolve with initial treatment. Number 1. Endoscopy. Your upper digestive system is examined by your doctor using a scope. A scope is a hollow tube with a lens attached to it. This endoscope is passed down your throat into your stomach and your small intestine during an endoscopy. The endoscope enables your doctor to check for ulcers. If an ulcer is found in the stomach or small intestine, your doctor could take a small tissue sample or a biopsy to be examined in a lab. So what are my treatment options? Treatment for peptic ulcer disease includes eradicating the H. pylori bacterium and minimizing the use of painkiller medications. The medical treatment for GERD is along the same lines. Diet and lifestyle changes are an integral part of managing both peptic ulcer disease and GERD. So what are the medications that could reduce stomach acid production? Proton pump inhibitors are a type of medications for this purpose. They work to lower stomach acid by preventing the action of the stomach acid's cell pumps. These drugs are available even over the counter. Your doctor might recommend a 1 or 2 week course of these medications to allow you to make the required diet and lifestyle changes. Do not use this proton pump inhibitor tablets like pantoprazole over a long period of time unless it has been specifically prescribed by your doctor. Antibiotics may also be prescribed if Helicobacter pylori infection is discovered in your digestive system. Stomach acid neutralizing medicines. Sometimes your doctor might prescribe an antacid containing salts like calcium or magnesium carbonate. These are usually in liquid form and mixed with an anesthetic to quickly relieve pain while neutralizing all stomach acid. Long-term use of these medications could cause side effects like bloating, diarrhea, or constipation. It's important to note that these antacids only relieve symptoms. Diet and lifestyle habits can play the most important and significant role in relieving symptoms and promoting healing. So, what are the choices that you can make? Number 1, food choices. Avoid tea, coffee, and alcohol. Avoid excess spice and masala in food preparations. These foods can irritate the lower esophageal sphincter. Avoid animal fat rich and greasy foods as they take time for digestion and can stimulate excess stomach acid production. Prefer small meals rather than binge eating. This will help avoid reflux due to a loose lower esophageal sphincter. A healthy plant-based diet rich in vegetables, fruits, and whole grain is recommended. This can help both in recovery and prevention. What are the lifestyle choices that you can make? Number 1, maintain a healthy body weight. Do not lie down immediately after having meals. Eat your dinner early, as this will ensure that you do not go to bed on a full stomach, saving you from heartburn. By doing these basics well, you can save yourself from a lot of heartburn.